Testicular cancers are cancers which are a little less talked about. You don't hear too much about it. These are cancers arising from the testis, and these are seen usually in younger males. Most young males, they will come with swelling on one side of the testis. Now it could be they would have had some injury and then after that they detected and they saw the swelling, or it could be just a swelling which grows innocently. It may not be very painful also. And when we evaluate these cancers, we find out that that is a testicular cancer. We divide testicular cancers into two broad types. One is called as seminomatous germ cell tumors, others are called as non-seminomatous germ cell tumors. Again, there is a slight variation in the way they present and the way their markers are, but for us, essentially both the tumors are very, very curative cancers. Most testicular cancers, we are able to do blood tests and pick it up by sometimes with blood markers, and some blood markers will be very high. It may be beta HCG, it may be an alpha fetoprotein level, it may be an LDH level, and with that we will be able to kind of diagnose the testicular cancer. Now, once you do a staging of testicular cancer, if it is localized to the testis, just by doing surgery, most patients are cured. Some of these patients would require some chemotherapy, but the curative potential for testicular cancers is very good. This is one of the type of cancers where even when it has spread to distant organs, even if it has spread to lung, the cure rates with chemotherapy and surgery integrated treatment is very, very good. Now, worries for young males always is when there's removal of a testis, how will the sexual life be in future? Yes, there is reduction in the sperm count. There will be issues with fertility, and that's why in most testicular cancers, before you start the chemotherapy, we always do a sperm cryopreservation and we freeze the sperm so that later fertility can be preserved. But sexual function should not be a problem, and these people can live a healthy, normal life. Late stage testicular cancers can present with different symptoms. That is, if the cancer has spread from the testis to either the lymph nodes or to the bones or to the lungs. Some of these patients may come with bone pains, with back pain, and when you evaluate you find bone lesions. They may come with cough which may be there, or breathlessness which may be there, because the cancer has spread to the lungs. And this is again late stage presentation. Once you evaluate the lungs, you find out the lungs are involved, and then when you evaluate the body, you find out the testis is involved. We have seen some of these patients who don't report to us early. Some of them come with various late stage symptoms, and then on evaluation we diagnose the testicular cancer, we treat them with chemotherapy, and these are patients who have still potential to complete cure in many patients.